Hey guys, welcome back to my channel. As you can tell, some things are different, especially my face, and that's what this video is about. This video is all about my jaw surgery and my first week post-op. So I'm going to be telling you why I had the jaw surgery and how I'm doing after the jaw surgery. I hope you can understand me. I'm still learning to move my lips and whatnot, and if anything is unclear, I will have subtitles down below if you need them. Hopefully this comes out clear though. Alright, if you're new here, thank you for coming. I'm Caitlin. This is a weird introduction video because, as you can tell, I'm not my normal self. But thank you for being here, and if you are not new and you are a returner, thank you so much for coming back. I love you guys so much. Let's get right into the video. Okay, so like I said, I just had jaw surgery. That's why I look a little bit different. And if you've been following along on my journey, a few months ago I talked about possibly having jaw surgery. Things just moved really quickly and I didn't have time to sit down and tell you guys why I actually got the surgery. So I wanted to show you guys a picture and just let you guys know like why I got the surgery done. So this right here is my mouth and my bite. This was before the surgery. So my bottom jaw was moving down and to the side a little bit, so it was hard for me to chew, it was hard for me to breathe, and it was just causing me a lot of problems. I actually choked on my food maybe like 4 times before the surgery. It was just getting worse and worse and worse, and I was like, you know what, I have to get the surgery. It's gonna benefit me. My insurance is gonna cover most of it. So I decided, you know what, this is what's best for me, and I went ahead and I did surgery. So I did get double jaw surgery along with 4 wisdom teeth being extracted. I got the wisdom teeth removed because they were gonna start messing up my bottom teeth. I think 2 of them had started coming out, but the top ones weren't really bothering me. It was mostly the bottom ones. So they just took all 4 out, and I was just under anesthesia, so I didn't really feel anything, and that was great. So all in one shot. But I really want to focus on the jaw surgery in this video and go over what my whole first week was. Currently, it's day 13 after the surgery, but I'm only going to talk to you guys about the first week and let you guys know how it went down and how my first week was. So I did write some notes, so just in case you see me looking off, that's what I'm looking at, just because I was so high on medication. I just had to write some things down just so I remember like exactly what I went through. And I'm also going to have some pictures over here on the screen so you guys can see exactly what I went through. So pre-surgery, you're not allowed to have anything to drink or anything to eat after 12 a.m. the night before, and that's because you're gonna go under, well, I went under general anesthesia, so I don't want to like pee or anything during the surgery. So you're not allowed to have anything to eat or drink the night before after 12 a.m. But that morning I did have a little bit of water just because I took a Valium 2 milligrams, which is an anti-anxiety medication, just because I knew what I was getting into and I felt a little bit anxious, so they prescribed me that Valium just so it would relax me a little bit going into surgery. So I took one of those about 30 minutes before going to the office to do the surgery. And by the way, my surgery wasn't in the hospital, it was actually in the surgeon's office. It was just budget friendly for me. It cost way more to do it in a hospital, and it just saved me a lot of money, and it was fine. As you can see, I'm perfectly fine. But yeah, so that's how that went.
That's cute. What's the video about?
The surgery.
Oh, really?
Yes.
Oh.
Goodbye. Do you think I'm gonna make a video like this?
Oh, that's so cute.
Go, bye. I have stuff to do. So going to the doctor's office, I took the pill. I also had to put my hair in a braid because after the surgery they put like this huge bandage around your face, so in order for your hair not to get stuck in that, they say like put your hair in a braid, just keep it out of the way. And I also had to cut a t-shirt and make the hole huge because in order for this shirt to get over my head, because my head was going to be the size of a balloon, we had to cut out the top of the shirt to make it fit on my face, well, over my face, and this is what it looked like. this is the huge shirt that I wore to the doctor's office. And basically you just have to come with a t-shirt on, a sports bra, because you want the shirt to come off and on really quickly before and after surgery, and then some shorts and your hair in a braid. So we got to the doctor's office. I was getting ready and whatnot, and the anesthesiologist, he just went over everything that was going to go down, how it was going to go down. And the thing that worried me the most was the anesthesia, because like not being able to control your body and knowing you're going to be put to sleep is like super scary, at least for me. I'm not sure if anybody or any of you have had jaw surgery, but it's like the scariest part. Like you forget all about the surgery when you know you're going to be going under general anesthesia. It's just a weird feeling, I guess. So I went into the OR room and I was trying not to look around because I was watching a ton of videos beforehand. Bad idea. When you're going to have jaw surgery, do not look up videos before your surgery. It's just going to freak you out even more. So I was trying not to look around because a lot of people said that they looked around in the OR room and saw all the tools, and I was like, okay, I'm not gonna look around. I do not want to see the tools. So I was like, all right, go sit down, do not look at anything. And the anesthesiologist was just like, oh, what music do you want to play? And I was just like, oh, you can play some Bon Jovi. Now I'm expecting them to be like, okay, we're gonna put the anesthesia in, it's gonna be really quick and we'll count down. Let me tell you, I'm pretty sure I passed out before they even put the anesthesia in, because I don't recall anything. I don't remember them saying 10, 9, 8 or whatever. I just remember listening to Bon Jovi for like a minute and that was it. I remember just waking up from the surgery. Like I don't remember anything, them saying they were gonna put meds in, nothing. I just remember like waking up, and thank God that I didn't have to experience that, because that was like the scariest part for me. So when I woke up in the recovery room, I woke up and all I remember was Damien sitting, my husband sitting to the right of me, and then his sister walking in the door and then being like, okay, you're ready to go. And then we left. I don't remember how I got to the car. I don't remember what elevator I went in. I don't remember any of it. I just remember getting home, laying down, and like passing out. Honestly, I don't remember anything from that day because I was so medicated. I don't remember a lot of it. I just remember getting home and everything being so numb and just being so exhausted. I just remember being so tired and just wanting to sleep the entire day. I'm pretty sure that's all I did was sleep, 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 take medication, and sleep some more. So I'm gonna insert some pictures over here of Damien feeding me. So the first few days you have to be fed through a syringe, and you have to get as much protein as possible, as much nutrients as possible, so you don't like pass out on the floor. So yeah, Damien had to feed me with a syringe, and I'm so glad I had his sister there. She really helped me because Damien sleeps through the night like a rock, and I had both of them sleeping in the same room with me at night just to make sure I was okay and to wake me up every 3 hours for my medication. So I'm so glad I had his sister there because she really took care of me. She always changed my ice and whatnot. And yeah, so when I first got home from the surgery, not a lot going on. But later on when I was awake, I think my brother came to visit me. I'm pretty sure I have a picture of that. And yeah, that was basically it for the first night. Now the second day, I had to go back into the office and they took out the stitches that were right on my cheeks. You can't see the scars. The scars are so tiny, and they just did that so that they could put I think it's like a bolt in there just to hold the jaw and keep it secure. So they took that out. I don't remember feeling anything. It was just like a little pinch. Honestly, you're completely numb, so you don't really feel it. They just checked everything and I was good to go home. So that was the second day, second morning after surgery. Day 2.
Let me turn the light on.
Mm. Oh no. So the day after surgery, all I really remember was just being numb, getting nauseous in the car because any movement makes you like super nauseous, and just having a lot of mucus in my mouth, being super thirsty, and just being exhausted. So like all I wanted to do was drink water, and I could only drink water through a syringe, so I was getting very frustrated and flustered. And I was just so thirsty. I just wanted to like drink a whole cup of water, but I couldn't, so it was just really tough for me. And a good thing that they had like medications for everything, so like the medication really numbed me. I had the anti-anxiety medication if I needed it. I had the nausea pills, which is really nice because when you start to feel nauseous, the last thing you want to do is throw up when you're wearing rubber bands to keep your mouth closed. So I had the rubber bands in all day for the first, I think, 3 to 4 days. And the only time I would take them off is to drink some smoothies or drink some milk or something that had nutrients in it for me. Other than that, you had the rubber bands on all day, and it was the worst ever. So my surgery was Thursday the 26th at 12. So the next day at 12, it was technically day 1. So on day 2, I actually got up. I started feeling a little bit better, like I could actually stand up. Of course, Damien and his sister had to walk me to the bathroom, make sure I didn't fall over, and I took my first bath that day. Of course, I needed help taking off all my clothes, getting it over my head because my head, again, was the size of a balloon. It was ridiculous, and I needed help just like doing the basic stuff, you know, getting back into my clothes, drying myself because you can't bend over. It was just a hassle. So the biggest thing I would suggest to you guys is having people near you to help you, because you can't do anything by yourself. Like, as much as you want to, you're just so tired, you're so high on medication, and like you just can't do anything, can't bend over. It's just ridiculous. So having people around me 24/7 was honestly amazing because they helped me brush my hair, braid my hair, get in the bath, get out of the bath, and whatnot. And it was just, I'm so thankful that I had those people around me during that time to help me. Very swollen. So day 2 after surgery, again, I said I took a bath, but I started feeling like hot and cold flashes. And oh my god, it was the worst. I was hot and then cold and then hot and then cold, and I'd have to have Damien or his sister fan me down because it was just so hot where I just wanted to like get up and like scream or something because it was just too hot. And it was only me. Again, your body's going through a lot with the medications, so it's normal, but it was the worst. And falling asleep starting on day 2 was really rough. I couldn't sleep. I was super uncomfortable, and it was just rough. And you have to sleep in like a chair where you like sit up because your face has to be sitting up so that the swelling goes down. So you can't lay down. You don't even want to lay down because you're afraid to like touch your face, you know. It was just really tough. Like that night, day 2, that night, starting to sleep was ridiculous. So day 3 after surgery, I started going to the bathroom by myself. And I was so exhausted that day because the night before I didn't sleep. So day 3 is when we asked my nurse if she could give us some sleeping pills. And I think they gave me Ambien. And that night I was just so tired, and because I only got a few hours of sleep the night before, I was like, you know what, give me the Ambien, I just want to pass out. And let me tell you, it did the exact opposite of put me to sleep. I was feeling antsy, and I'm telling you, I got like 3 hours of sleep that night. I was crying, and to cry, like my whole face hurt because like your face is so tense and tight. Like it was just the worst. Day 3 that night was the worst. And going into the surgery, my surgeon said the first 4 days are the absolute worst and darkest days of the jaw surgery. And let me tell you, he was not kidding. Those were the worst nights of my life. I honestly did not think I was gonna get through it. And you know, that day I just watched a lot of Netflix, so I wasn't really doing any activity to make me even more tired to go to bed at night. I just remember walking around and trying to exhaust myself just to fall asleep for a few hours because I couldn't sleep. And the ice pack on my face was just getting in the way, and it was heavy when I was walking around. It was just a mess and a blur, and I'm so glad that day is over. So day 4 after the surgery, I have to tell you, this was the worst day. And I think that was because day 3 that night I didn't get any sleep because of the Ambien. It did the opposite effect. So I had 3 hours of sleep. I was just so tired. I started feeling pain, and it was mostly on the right side of my face, but I started feeling pain. I was super nauseous. I was crying like the entire day. I didn't think I was gonna make it through. I had taken like 3 warm baths just trying to relax me. It was just really bad. That day was really bad, and I was just struggling to get through that day. Not only was I just so exhausted, but I started bleeding from the inside of my mouth. So after jaw surgery, if you start bleeding inside your mouth, you're gonna freak out a little bit. And this blood was just coming out, and I was having to like wash it out, rinse it out with a syringe, and it would not stop bleeding. It was bleeding for like 4 hours straight. And it was bleeding from like a place right over here. And I'm gonna insert a picture. If you do not want to see the picture, I suggest skipping through this really quick. You can't really see it that well, but it was a suture. So inside your mouth, they like make little ties, and the suture eventually dissolves and comes out by itself. But I have a few in my mouth, and there was one right here which was bleeding, and it would not stop bleeding. And I think the next day I had an appointment with the surgeon, and that night, like I said, it was bleeding for 4 hours, but I didn't want to bother my nurse because I was going to see her the next day. So I eventually just put a cotton ball, stuck it in there, changed it out maybe 4 or 5 times, and just kept rinsing it out. And rinsing it out really helped, and the bleeding stopped just in time to go to bed, because I was like, oh my god, I do not want to go to bed while I'm bleeding inside my mouth. I don't want to eat. I don't want to do anything because I don't want to eat the blood, you know what I mean? And that day, day 4, I believe, I was starting to eat applesauce, yogurt, anything super soft, soups that were put in the blender and made really liquidy. So anything super soft I was doing. I was able to get a tiny spoon in my mouth, and I was doing little accomplishments, but I still was needing help. And I also needed a camera or a mirror in front of me so I could see where I was putting the spoon or when I was drinking, because when you are on day 4 still, you still can't feel anything in your mouth. So you have to like make sure you're putting the food in your mouth and not on your nose or something. So yeah, that's how day 4 went. And then the next day I saw my surgeon. Day 5, they said everything was looking good. I didn't have to wear the rubber bands every day. I just had to wear them just at night, and they gave me a rubber band that was looser than the one I was using before, so that was a relief. It was scary not using the rubber bands for the first day because you feel like your jaw is just gonna fall. Like you don't have control over it, so you think it's just gonna fall. And it was scary because when you're not wearing the rubber bands, your jaw is able to move, and in your mind you're like, oh my god, my jaw should not be moving, it needs to stay in this one spot. So starting with day 5, I started feeling like little shoots of pain in my face, meaning that the feeling was coming back. And I mean, that's a great thing, but it feels super weird because randomly you'll get like shots of pain in your face and you're like, okay, what is happening? Like, stop. The more you feel that, the more feeling you're gonna get back, and the less numb you're gonna feel. So it's all great, and you just have to look on the bright side of things, like one day at a time, basically. So after day 5, things started to get a lot better. Day 5 to day 7, I started talking more, because in the first few days, like, you just had to text and or write something down because you can't really move your face or your mouth, so you're just like writing notes and telling everybody what you need. So I started talking more, moving my mouth more. Again, I was starting to eat applesauce, yogurt, again, smoothies, Boost and Ensure drinks. And I started taking my Advil, like these little tiny pills, by mouth instead of crushing them up, because we had to crush them up before because I obviously couldn't fit anything that big in my mouth. And it was the worst medicine ever. I mean, all the medication I was on sucked, but the Advil was the worst because crushing it up and taking it down, it like burned my throat really weird. And it was just the worst thing ever. So once I started being able to swallow those Advil pills, I started feeling a lot better. I stopped taking the high-end medication. I think it was hydrocodone. I think that's how you say it. That's what I was taking, so I was glad to be off of that. And I was just taking 800 milligrams of Advil, I think every 6 hours, just to keep the pain on a minimum and, you know, get through the day. So again, once you hit day 5, everything starts turning around. You start feeling better, more motivated to get better, and those first 4 days are over and you made it past the worst days of your life. So currently I only take 2 Advil in the morning, 2 Advil at lunch, and 2 Advil at dinner. I only use my rubber bands at night, and I would say I'm about 45% numb. I can't feel my bottom lip. I can feel my top lip a little bit. I can't feel my chin or anything down here. I can't feel this. I can feel this, I think, but I can't feel this at all. I'm doing little massages every day, trying to get back that feeling. I can go shower by myself, which is amazing. I can go pee by myself. And I can actually kind of lay down while I sleep now. Sleeping is still really rough for me. It takes me a while, and I wake up like 2 times at night, but at least I'm sleeping at least something. So I'm feeling a lot better. I'm able to eat Jello, soft pasta, yogurt. I can eat cereal if I soak it in the milk really good. And my 3-week appointment is next week. And hopefully I'll be doing even better by then, and hopefully I'll stop stuttering, because oh my god, talking is exhausting, let me tell you. I just want to rest, and it's kind of ridiculous, but it's so exhausting to talk and to eat, and it takes you like 30 minutes just to eat half of your food, so it's a lot of work, but I'm getting there one day at a time. And yeah, I hope you guys enjoyed this video. If you guys want to see more jaw surgery things, I'm thinking of doing a video about jaw surgery necessities and everything you need before going into jaw surgery. And because there are a lot of things that you need that not many people will tell you. So I'm thinking about doing that video. If you think that'd be a good idea, leave me a comment down below so I know. And yeah, I will update you guys soon. Hopefully my face will be less swollen than it is right now, and I'll be able to talk more clearly. And hopefully I can get these braces off soon. I'm not sure if I mentioned, but I do have braces, and that's what the rubber bands are holding on to. But hopefully I get these out soon, because they are tearing up the inside of my mouth. So there are a lot of things to look forward to. So again, thank you so much for watching. I will see you in my next video, and I hope you guys enjoyed. Bye.